During follow-up visits, patients usually will ask, well, how am I doing? And then I'll ask them, well, how are you feeling? And I usually, I'll want to know, have they been hospitalized? How's their breathing? How much activity are they doing? How much activity can they tolerate before they have to stop and rest? And so I think, looking at their functional capacity is helpful in figuring out how they're doing. And then also, oftentimes we'll pull up their lab results. And so we'll look at their biomarkers, their troponin and their NT-proBNP levels, and we can trend those over time. So I'll pull up a graph and we can look at those together.
Indication and important safety information. Indication. Attruby, acoramidis, is indicated for the treatment of cardiomyopathy of wild-type or variant transthyretin-mediated amyloidosis, ATTR-CM, in adults to reduce cardiovascular mortality and cardiovascular-related hospitalization. Important safety information. Adverse reactions. Diarrhea 11.6% versus 7.6%, and upper abdominal pain 5.5% versus 1.4% were reported in patients treated with Attruby versus placebo, respectively. The majority of these adverse reactions were mild and resolved without drug discontinuation. Discontinuation rates due to adverse events were similar between patients treated with Attruby versus placebo, 9.3% and 8.5%, respectively. Laboratory tests. Mean increase in serum creatinine of 0.2 and 0.0 milligrams per deciliter, and a mean decrease in eGFR of 8.2 and 0.7 milliliters per minute per 1.73 square meters was observed in the adults with ATTR-CM treated with Attruby versus placebo, respectively, at day 28 and then stabilized. These changes were reversible after treatment discontinuation. Use in specific populations. Pregnancy and lactation. There are no data on the use of Attruby in pregnant women. Animal data have not shown developmental risk associated with the use of Attruby in pregnancy. There are no available data on the presence of Attruby in either human or animal milk, or the effects of the drug on the breastfed infant or maternal milk production. Please see full prescribing information for Attruby at attruby.com/PI.